Our next stop now is Zambia, where the government in the country says it will decentralize the recruitment of the 11,200 health workers once consultation with various stakeholders like the Minister of Finance and Secretary to Cabinet are concluded. This is according to the Ministry of Health Permanent Secretary George Mawende. Dr. Mawende said they had done away with the earlier method of people applying at the Ministry of Health headquarters, maintaining that recruitment of doctors process will be decentralized to the district level, then provincial.
Well, yesterday, unemployed doctors under the Resident Doctors Association of Zambia marched to State House to seek audience with President Hichilema on the alleged delay to employ them for the past 2 years. The protesters were, however, blocked by armed police officers who advised them to return to Ridgeway campus to be addressed by Ministry of Health officials. Joining us this morning is Dr. Mpanga Bwaya, Vice Chairperson of the Unemployed Doctors. Dr. Bwaya, recently the Minister of Health had announced that the recruitment process will start this month, and yet it seems that it's not coming to fruition. Do you think you could have exercised a little more patience before doing the protest?
Yes, definitely. We should have exercised more patience. But initially, this is not a case of being patient or not. This has been an ongoing process. Of course, we understand that the new government came in as of August last year, but it's also a matter of urgency. We have held a lot of discussions with the Ministry of Health. It's just that they keep on giving us incoherent statements. Moreover, in addition to the incoherent statements, there's some conditions that are attached to the employment of doctors. Recently, the Minister of Health, Madam Sylvia Musovo, gave a statement to say the recruitment process is going to start this month end. As of now, we only have about 5 working days until the month ends. This is in addition to the condition she gave that only the volunteers should apply. It has never been a qualification for a qualified doctor for you to volunteer first, and then that's when you'll be applied by the government. Moreover, in a closed meeting with the Resident Doctor Association of Zambia, she stated to say only about 100 doctors will be employed. So our cry, rather the reason for our peaceful protest in the beginning is that why should they only employ 100 of doctors when the country needs more than just 100 of doctors? Okay, there's people who are dying in hospitals and the streets and all that, all due to the fact that there's not enough human resource. So we are saying this is a matter of urgency, and only we're asking to say we know that it's not possible for all the 800 of doctors to be employed at once. So we're asking to say, can the ministry, okay, give us a direction? Moreover, we have resourced all avenues. We've been in several discussions with the Minister of Health, and therefore our protest was we should seek audience with the President, because it is only him that can help us. It is only him that maybe could understand our plight, because we followed the hierarchy that we're supposed to follow and nothing is being done. It's one story after the other. Meanwhile, people in other districts of this country don't have doctors, don't have professional healthcare providers. People are dying. So this is our cry basically to say, yes, the recruitment process should start, but can you give us a time frame to say if this number of doctors are going to apply, when next are we going to expect for the other 800 doctors? Because those 800 should be part of the 11,200 doctors that are supposed to be recruited this year. So we're asking basically for a time frame. And the intervening of that peaceful process is to seek audience so that the President could probably give us to say, okay, this is the direction that my government is going to take. Thank you very much.
All right, Doctor. Now, I mean, you have clearly gone through the procedure, the protocols is needed, but no action has been taken, hence the need to reach out to the President himself, just as you have rightly said. Now, can you walk us through the way forward now? I mean, having heard what the Ministry of Health has come out to say, what's the way forward for the doctors?
So the Ministry of Health didn't exactly come out. Who we had a discussion with during the protest was the permanent secretary for technical services. So ideally, we're supposed to be addressed by permanent secretary of under administration, because he's the one that directly relates to our employment issues. However, what the permanent secretary technical services came to say to us wasn't anything new. So we were kind of not satisfied to say, you know what, you're telling us, Professor, you're telling us the same things that we've been hearing from the ministry, of which is not satisfactory. Can you give us a time frame? Let us know to say, okay, by this time we should expect this and this, and by so doing, this is what we should follow. In as much as you're asking people for patience, it's important at least to give them, to say, a plan and a direction, to say, you expect this, and from here, this is what we're going to do. So therefore, we'll keep on crying out. And as of yesterday, since our protest was intercepted by the police, so we started the process of acquiring a police permit for a peaceful protest again. We're hoping that by the time the permission is going to be released, or hopefully to be successful, that we're hoping really that the president will come through to us and at least say something over our plight. Because, you know, as a matter of urgency, once the recruitment process starts, we don't even know the condition. They're not sort of like advertising it. We don't know how they're going to be picking those people. We've got people who've been volunteering for 3 years, which is not okay. No incentives given, but they're put on the front line. You know, the ongoing pandemic, COVID-19, and there's diseases such as hepatitis, you know, diseases such as tuberculosis, commonly known as TB. So there's so many, you know, inconveniences that are being done within the doctor's profession, and we're saying no to that. That should come to an end. So we're hoping really that the president does give us a way forward to this situation before we actually get to, you know, have that peaceful protest again. Yes.
Well, the way you've put it, it seems that there is no solution in sight. There seems to be a deadlock, not hearing from the government and possibly not also knowing what the future holds for the doctors. But anyway, are you going to go for another protest if there's a delay in a response? Just briefly, are you looking to go for another one?
Yes, definitely. Since our aim yesterday was not achieved, which was to seek audience directly of the president. So, and that's what we really want as unemployed doctors. We want to seek audience with the president himself, because we feel that we have exhausted all avenues and they're not bringing us the results that we wish to have. You know, it's neither negative, it's neither positive, it's right in the middle. So we can't really be indifferent towards this situation. And time is of the essence, you know. It's very sad that, you know, when you're in a comfortable position, you cannot really understand the plight of people in the rural areas, you know, in other districts and everything. We're not talking about the capital city of Lusaka. It's easy for you to acquire health services from somewhere. All you need is money. But we're talking about people in the villages who have to walk maybe long distances, and, you know, to go there to find that there's no doctor, there's no any person to attend to your needs. It's very hurtful. That shouldn't be the time, this time and age. So we're asking and actually hoping that the president will come through, you know, before that. Otherwise, our next peaceful protest is scheduled to be next week on Tuesday.
Thank you so much.
2nd of March. Yeah.
Thank you. Thank you for speaking with us, Vice Chairperson of the Unemployed Doctors, Dr. Mpanga Waya, for being here on Breakfast Central. We hope that you do find a solution to this problem.
Thank you very much. Thank you for having me.